Hello everyone, I am Dr. Varsha Monica Reddy, working as Pediatric Neurologist at Yashoda Hospital, Hyderabad. Today we'll be discussing about development and when to suspect abnormal development in a child. There are domains of development. The first one is gross motor, which involves with movement and posture. The second one is fine motor, which involves with fine movements and skills. The next is cognitive, which equals to intelligence and thinking. The next is personal social communication, and the next domain is communication, both verbal and non-verbal. What are the red flag signs that you can observe in a child at 18 months of age? If the child has trouble seeing or hearing, does not follow simple commands, if the child is not walking by himself, if the child prefers to use only one hand, if the child does not say a single word, and if the child does not point or use gestures. What are the red flag signs that you observe in a 2-year-old child? If the child does not see or hear, if the child does not run or climb stairs, if the child is not using words together or joining two words, if the child has poor emotional expression, if the child has no pretend play, if the child does not copy actions, if the child does not scribble. The causes for impaired brain development can be many. It could be cerebral palsy, hearing impairment, visual impairment, speech delay, intellectual disability, learning disability, behavior problems and ADHD, and autism. What do we do when a parent suspects a delay in child development? So whenever you visit your pediatrician for the regular immunization, check for the milestones in all domains, not just motor or fine motor, also the speech and social communication. And if there is any delay and the child crosses the upper limit of the age for that particular milestone, then you have to consult a pediatric neurologist or a developmental pediatrician who can assess if there is a delay or what is the cause for the specific delay. How do we prevent developmental delay in children, or how to be cautious? Provide good health and adequate nutrition, responsive caregiving, be attentive and follow the cues that the child gives and be consistent. Give your child the opportunity for early learning. Enrich your home environment. You have to practice interactive parenting. Involve in play with the child. Provide safety and security. Prevent your child from all the hazards. Provide safe environment. Protect your child from physical, mental abuse and stress. Thank you.